Yes, my name is Dr. Torre Brown, and I have multiple conditions. I was first diagnosed with chronic migraines, which we in our family call the family curse. At the age of 10, they started my family, which it would have been 33 years ago. But my main chronic illness will be fibromyalgia. I suffered from that for 18 and a half years, diagnosed in 1998. Depression, also 19 years around the same time, and primary and biliary cirrhosis for 11 months. A typical day, every day is in pain. A discomfort day, that's a normal day. You wake up in pain, you go to sleep in pain. We have what we call, when you suffer from chronic illness, flare-ups, where you just can't do anything, where you're pretty much kind of bedridden. But I say that I'm in pain all the time. Your joints ache, your body ache, you feel like you have the flu, but you don't. To be touched, you're very sensitive. It's almost like if someone touched you, it's very achy. You have what we call it fibro fog. You have like a loss of memory. You can't remember a lot. Everything is a chore. It's hard. I tell people, typical things that people take for granted, it's hard for us to do. I have an 11-year-old, and if I get up in the morning, brush my teeth, take a shower, get her up, get her ready for school, take her to school, I feel like I conquered the day. My doctor would say, when I go to him, he's like, I have no idea how you do it. How did you even walk in my office? And I tell him all the time, I have two little eyes looking at me. That's why I do it. That's how I do it. It's not easy, it's not comfortable, but I have no choice. That's why I get up every day, and that's why I continue to do it.
My name is Torre Brown. Dr. Torre is my mom. My mom's condition has impacted me, I wouldn't say in a bad way, or I would say more so in a good way, because I would say as a child, as a daughter, or even as a son, you will want to see what your parents go through. Sometimes seeing their struggle makes you better as a person. And so it's hard sometimes when you see your mom down, when you want to go in there and have fun with her and laugh with her and watch shows sometimes, but then that is something you have to live with, because she does have a condition. You have to do what you have to do. And then having my younger sister, when my mom is, I guess, going through a flare-up and she is not feeling well, I have to take care of her and just be the older sister. And then it also is hard when you hear other people, well, she's always laying down, she's not doing nothing. And it's just that they really just don't understand what's going on. So it is hard most of the time, but you just have to work through it. The advice that I would give my peers would just be to just listen. And not only to listen, people feel like listening is just really just being there and sitting in front of the person that's trying to talk to you. What I mean by listen, like try to understand where they're trying to come from. They'll be like, well, you're only doing this because you just don't want to do anything. Well, that's not the case. Sometimes they are going through a lot of stuff. And when somebody's trying to talk to you and tell you what they're going through, they need you to listen to them. And they need you to hear them out and let them know that you're trying to understand what they're going through. And it could be your best friend, it could just be some stranger, but sometimes when they're trying to talk to you, you may be the only person that gets to hear them out, and that makes their day at the end of the day.
Be your advocate, research your illness, research treatments, know what you're dealing with. you're your best advocate. You know, doctors have hundreds of patients, multiple patients, they have a whole caseload, and you only have you, you know, and so you have to have your best interests at hand. Go into the office with your list of questions, know what you need to ask your doctor because they only have a limited time. Write it down, already going in, knowing what you want to ask. Every time my doctor tell me, okay, this is what medication I want you to try, I researched it first, you know, and I looked into it or whatever, because there are so many different treatments out there, and you want to make sure you're getting the right treatment. Because, and that's the ugly side of it, is that when you have multiple illnesses, unfortunately, I have to prioritize my conditions and symptoms. Whichever hurts the most, that's what gets the most attention. And that's the sad thing about it. I have multiple prescriptions that cost me almost $260 a month. And so even with insurance, and that's the part that people don't talk about. I have to take a pill to get up in the morning that gives me energy just to get out of bed. And then I have to take a pill that kind of takes me down at night to help me sleep. But also, all that medication has given me an ulcer. But those are medications that's required to treat the chronic pain. So it's not always pretty, you know, but these are things that comes along with the situation, and it's hard, but we do what we have to do. Dealing with the stigmas, you know, you don't look sick. Hey, I know I'm cute. I know I'm pretty. You don't have anything to prove to anybody. And that's how I look at it, you know. My only competition is myself, you know. Join organizations. I belong to 5 mental health organizations, 2 fibromyalgia organizations, and 2 migraine awareness organizations. And I don't do it for the accolades. I do it because for the research, the advocacies, and to be a part of the change. Who's better to tell our story? Who's better to bring the change than us? We know. What we know, you can't learn from a textbook. And the quote I came up with, because I'm barely making it here, I'm struggling. And the quote I came up with is, when you're struggling just to keep your head above water, it's amazing how God will still pick you to lead the group and be his co-captain. And that's what I came up with.